Hi, folks. This is Dr. Rob CYWES. I am the carb addiction doc, and as you can tell, I'm a little stuffy. I've got my nose and my lungs are a little bit bad. Still got a little bit of a cough. And the reason I'm a little bit sounding sick, I'm not really sick, is I have just had an amazing, amazing procedure done in the south of Spain. So at the beginning of this year, I had a CAC score done, a coronary artery calcium score to evaluate my heart, and I found that my score was over a thousand, set up for a heart attack. I was feeling fine, but my CAC score was high. I had a lot of calcification. 4 out of my 5 vessels were plugged up, and I was petrified. So I started to do my research because I didn't want stents. I didn't want other things happening to me. So what I did is I reached out to a group. Let me just get this centered. I reached out to a group um, in the south of Spain, in a little town near Sevilla in Spain called Aracena. And Aracena is in the heart of Andalusia. And there's a clinic in Aracena that has done some amazing, ridiculously good research. And I can tell you this up front, I have reduced my CAC score by 826 points. I was a little over 1,000. I'm down 826 points based on the procedure I'm going to talk about right now. So, 10 days, 2 weeks ago, I flew over to Aracena, Spain with my family, and I admitted myself to this clinic. Now, my Spanish is not very good, but it is the Todoya na Ejoya Institute. It's bizarre how the Spanish pronounce it, but it's the Toidi na Ejoya Institute in Andalusia. The town itself is Aracena, a little town just west of Sevilla. And at this institute, they figured out a couple of very, very important things. Number one, they figured out that early on, when you've got a rising CAC score, a lot of that plaque is, some of it is calcified, some of it is soft plaque, but if they can compress the calcified plaque, they open up the blood vessel and that calcified plaque is stable. It's like an old scar instead of like a fresh scab. So the first thing they do is they use a lipid emulsifier um, to extract the lipid and the fat that LDL has deposited in the plaque in my blood vessels. And then the cool part is they reline your blood vessels with cells that are resistant to inflammation, that are resistant to atherosclerosis. That's the principle. And they've got 10 years of incredibly good results using this methodology, and it's very safe. So why am I sick sounding? Why am I sounding like I am? And I'll explain the process to you. The reason for that is when you have an angiogram, the conventional coronary angiogram, they either go through your groin, which is into an artery, they can go through your wrist, and that's associated with about a 0.5 to 1% heart attack risk, where they can potentially knock off some of the blood vessel, some of the plaque, just getting up into that blood vessel. They got to go through everything. The approach that these guys use, they give you sedation and they actually go through the airway, through a bronchoscopy, and they go through your trachea, through your airway. And as you know, the heart sits in front and the lungs sit kind of right behind this. So at the bifurcation of the trachea where it branches to your left and right lungs, they go straight through there. As a pediatric surgeon, I know we see tracheoesophageal fistulas at that level. They go straight through that soft gelatinous part um, between the last rings of the trachea, and they go straight across into the root of the aorta. Now, remember, the aorta, the heart's in front, the aorta curves backwards and goes down. And where it begins to curve, you can access the root of the aorta, right where the valve is, just above the valve. That's where the coronary vessels are. And there's usually 3 major coronary vessels with branches coming down. They can access those vessels directly without having to go through all the other blood vessels. And all they have to do is to be right at the mouth of the blood vessel. So they go across the bronch, no radiation involved, go straight into that little vessel. And the first thing they do, it's a 2-stage procedure. Excuse me, you see, I'm still coughing a little bit because of the irritation in my airway, but that goes away, they say, within a week. I'm only a few days out from the final procedure. The first thing is that they do is they've worked out that they can use a lipid a biologic lipid emulsifier. And here's the thinking, and it's brilliant. We know what LDL is. LDL is a transport molecule for fat from your fat cells to your body, and it's LDL that deposits fat in your plaque and creates the fat in the plaque. And what happens is macrophages, when they get activated, they attach through the ApoB100, which is a little protein that's got a receptor on the macrophages. It attaches and it dumps its load of fat that then accumulates and causes the plaque. That's how LDL causes vascular inflammation. It's not just the LDL, it's the inflammation that causes the activation of the macrophages. So here's what they've done. Brilliant, because they know that LDL sticks very easily to macrophages. So they said, okay, let's use LDL. Let's harvest LDL. So the first day you go into the clinic, you can see I've got a bruise over here. They put a needle in, they suck that blood out, and they harvest the LDL from my own body. So it's my own LDL, it's my own protein, so it's not a foreign substance. They then take that LDL capsule, and remember the LDL capsule, the outside is hydrophilic, it can travel in water, and all the lipids are in the front. So what they do is they extract from those LDL molecules, they extract the phospholipids, they extract the cholesterol, they extract the phospholipids, the triglycerides, the cholesterol, they empty it out. But you've still got the shell, you've still got the carrier. And then what they do is they fill that carrier, and this is just brilliant. They fill it with a molecule that is already natural in my lungs. Now they're already in my lungs. They extract a molecule called surfactant. And surfactant is something we use when we breathe. It creates a little soap bubble, but surfactant is a biologic emulsifier. So when they're down there with a bronch, they extract the surfactant and they fill the LDL, this LDL shell, with surfactant. Now, surfactant is a fatty molecule, so they have to fill it with in this molecule that then can travel in the blood vessel. And they take this LDL, they multiply it over 48 hours in the laboratory, then they go down with a bronch, and they put a little catheter from the airway into the root of the aorta, and they inject this transformed LDL. They inject the transformed LDL into each blood vessel. And remember, the coronary vessels are in circulation. So they inject it, it sits in that coronary vessel for a little while. And because the ApoB100 is activated, the macrophages immediately attack and attach that LDL. So you're getting a concentration of LDL filled with surfactant at those macrophages. And what the surfactant then does is it emulsifies the cholesterol that's already there, and the cholesterol dissolves and breaks away and just floods, but it's liquid. It just goes back into the blood vessel, into the blood, goes to the liver, and the liver gets rid of it. So the first thing, over the course of 3 hours, they slowly infuse this emulsification into each of the vessels, and they remove it. Now, during that removal process, you require activation of the macrophages. So they purposefully activate the macrophages, okay? However, the second thing that this clinic, this airway clinic has, and it'll be in my show notes, the name of the clinic, so you can Google it and look it up. But Ph.D. I've got to say that properly. That's how something like that. If you speak Spanish, you know what I'm talking about. Anyway, what they then do is they activate the macrophages so that they take up all these LDL, surfactant-filled LDL molecules, emulsify the fat in the vessel wall, and it circulates and it sits there for a while, and you just see this on the screen. You can see the collapse and you can see the increase of flow across the vessel over the course of 3 hours. Incredible to watch. And because I'm just sedated, I can actually watch it on a screen. The next thing they do, and this is where their brilliance comes from, and this is why Aracena is such an important part, and it's just how a confluence of things comes together. In Aracena, Spain, it is the heart. For those of you that know pasture-raised hogs, pasture-raised ham, they've got all these pigs out there that are raised on pastures, and there's two critical elements that these pigs are raised on. And this is how they discovered this, because it's the ham-producing part of Spain, world-renowned. But what they do is they feed these pigs two things. They feed them cork oak. Now, the cork oak, when you drink a bottle of wine, the cork comes from the bark of the cork oak tree. So they harvest the bark, but the acorns of the cork oak, so think cork oak acorns that they feed to their pigs, and also chestnuts. This is also a chestnut growing part of the world. So they got these chestnut forests with cork oaks and chestnut forests in this Aracena part. Beautiful. If you look at my Instagram feed, I've got a video of me and my son running around with a cork oak tree and the chestnuts. But they harvest these chestnuts and acorns and they feed them to the pigs, which flavors their meat. But they also found that these pigs had elastic, pristine blood vessels. And when they analyzed what was in these chestnuts and in specifically these cork oak acorns, they found two things. And they found, first of all, vitamin F3 that is exclusively in the chestnut, the wild chestnut. So those of you in Ohio State country, the Buckeyes, they harvest chestnuts or Buckeyes and they extract vitamin F3. Okay. The second thing that they extract from the chestnuts is a stable oxygen-free radical called O2 minus. O2 minus. So what O2 minus does, first of all, what F3 does is F3 bonds to the thromboxane A2 molecule on platelets, and like aspirin does, blocks the activation of platelets. So it's an antiplatelet aggregation, more powerful than Brilinta. Hasn't been FDA approved, but they do use this in Europe, F3. After you've had stents placed, they use F3 instead of Brilinta or Plavix as a much more stable antiplatelet molecule without causing bleeding. So F3 is well known in Europe, not so well known in the US, but they use F3. The second one is the O2 minus or the oxygen-free radical. What that does is it stabilizes the activation of white cells and macrophages. So it binds permanently to the receptor on the cell that produces nitric oxide. Normally what happens is the antioxidants bind for a little while, you get some nitric oxide, which is your beneficial anti-inflammatory molecule. Everybody knows what nitric oxide is, how important that is in the clotting cascade. Well, this O2 minus free radical binds permanently to the nitric oxide receptor, and at a low level, the cells are continuously producing nitric oxide, which is one of the most powerful antioxidants. You got F3, you got O2 minus, and then from the cork oak acorns, they've got a product. It's not a vitamin, it is a molecule, it's a protein molecule called, I've got to get this right, lemingam, lemingam, which is the fourth or the third of these crucial molecules that they infuse at the end of their lipid emulsifier, their surfactant LDL molecule. This lemingulum stabilizes macrophages. So it prevents the macrophages from attaching to the ApoB. It blocks that ApoB receptor. And lemingam blocks that receptor so that the LDL detaches. So up front, they give you the lipid emulsifier with the new LDL. Sorry, I keep doing that. I'm so excited about what's happened to me. Sorry about my voice. It's still hoarse where they bronked me. But what they do is right at the start of the infusion, they infuse the lipid emulsifier, the LDL molecules with surfactant to chew up the lipids, but they also, to relax the endothelial cells, give you the oxygen-free radical, the O2 minus, and the F3 molecule that stabilizes the platelets. So they give these molecules to stabilize the inflammation while the lipid's emulsifying. But then once they want to do this, they want to disconnect the lipid emulsifier. So they give you the lemingam right at the end of the procedure that shuts down the receptor on the macrophage. The LDL disconnects, goes back to the liver, and just gets processed. Now you've got beautiful, pristine blood vessels, but you still have damaged endothelial cells. And here's where their brilliance comes in. So what they've figured out, and it's pretty intuitive, it's obvious to me as well, is what they've figured out is this, that if you look at vascular endothelium is very easily activated by substances like nicotine, carbohydrates. There's a variety of drugs that activate nitric oxide, at least uric acid, things that can activate the vascular endothelium. But there is another vascular system in the human body that never gets inflamed, that never gets clogged, that never gets blocked, that never gets inflamed, and it's a single vessel layer. And that is the lymphatic system. So you've got the venous system, the arterial system, and here you're talking about clogs in the arterial endothelium. But now you've got the lymphatic system. And the lymphatic system, there's this Spanish guy, crazy crackpot Spanish guy, working in Aracena, by the name of, again, I've got his name is Professor Leaf, Professor Leaf or Loaf Lepra is his name, Loaf Lepra. I just called him Prof. Loof. But what this guy discovered is that the endothelial cells from lymphatic vessels don't get activated. They don't get activated. They just lie there nice and thin. They don't swell up. They don't get activated because there's no reason for them ever to get inflamed. You don't injure them. Okay? You injure them, they reform, they regrow. And we know that lymphatics are growing all the time. So what he does is he goes in, again, through the lungs, and you've got this big blood vessel, not blood vessel, lymphatic vessel that goes from the gut, the cisterna chyli, that goes all the way up to the left side of your neck and dumps all the lymph into your blood vessels. That's the fat from your gut. That's where the long chain fatty acids go. So what he does, he goes in, again, this is why it's done through the lungs. And with a bronchoscope, he harvests a small amount on that first bronchoscope, where he's harvesting the LDL, he's harvesting the surfactant. He also harvests lymphatic endothelial cells. And in culture, these cells grow very quickly. So in culture, over the course of 5 days, it's a 5-day multiplication. They duplicate every 6 hours. He grows these layers of lymphatic endothelial cells. And at the end, when he's used the limingulum to quieten down the beta cells, the macrophages, he then infuses through this catheter, through the trachea, into the coronary vessels. He infuses these native, they belong to me, so they don't need immunosuppression, these native lymphatic endothelial cells. And these lymphatic endothelial cells lay down over the vessel, over the plaque, and they smooth it all out. So not only have they gotten rid of the plaque and dropped my CAC score by 826 points, 826 points in 3 hours. Impossible to do any other way. Stenting bypass doesn't do that. And then they infuse these lymphatic endothelial cells that line the blood vessels, and they don't react. So even if you're diabetic, even if your nitric oxide's high, you've got gout, even if you've got autoimmune disease, non-reactive, these boys just lie there, and they've got 10-year data on a variety of different patients, 10-year data where nothing bad is happening. It is quite incredible to see how well this works. So I would urge you to go to Google, go to ChatGPT, look up the Toidi na Ejuyo, Eruoy. I'm not even sure. Spanish-speaking people help me. The Ejuya Institute in Aracena, Spain. Look up Dr. Professor. He's always, I'm not a doctor, I'm a professor. Professor Lepra, I think, or Lepra is his last name. Google him, check him out. It costs a lot of money. It does cost a lot of money to get this stuff done. There is risk involved, but I'd rather take the risk of this procedure than the risk of dying of a heart attack. And I was able to save up. I was able to collect my money together, fly over, have a good vacation in Spain with my family, and do this. So strongly recommend looking at this. And instead of having a stent or a bypass, try this. I strongly recommend it. And I hope today that you have a wonderful day. Today, the 1st of April, 2025, is the first day of my new life. I'd like you to think the same. 1st of April, 2025, at my current age, this is the beginning of my new day. I hope you've enjoyed this visit. Please leave comments. Please leave all the comments you can. If you want to know more, you can call or text us to area code 561 617 1010, and we will give you all the information about this clinic. Or alternatively, you can, if this benefits you, leave some money at our PayPal account, leave some money at our on our Patreon account. If you've benefited, if this helps to save your life, throw us some money. If you smiled at this discussion, the third of these incredible metabolic health discussions that we've had every year on this day, let me know. Thanks for your attention. I am the Carb Addiction Doc. Smile, 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 because April the 1st is the first day of your new life.